Hey there! Welcome to the Cognitive Development Learning Center, a specialized learning intervention center for children with learning challenges. In this video, how is learning intervention different from therapy?
So, your child is struggling in school, and suddenly you're trying to navigate this whole world of support options. You hear words thrown around like tuition, intervention, therapy, but what do they actually mean? And what's the real difference? Well, today, we're going to break it all down to help you figure out the best path forward for your child.
Look, it's a feeling so many of us parents know. You see your child putting in the hours, really trying their best with their homework, but the grades just don't reflect that effort. It's so frustrating for them, and honestly, it's heartbreaking for you. You know how smart they are, but something just isn't connecting. So, what do you do?
And, for most of us, the first thought is pretty logical. If my kid's failing math, the answer must be, well, more math. And that's exactly the idea behind tuition, which is usually the very first step we take to give them that academic boost.
Let's start right there with tuition. It's really important to understand what it's designed to do. Think of it as a content fix. Its whole job is to reinforce what your child is being taught in the classroom.
And look, tutoring can be amazing if your child just missed a couple of classes, or maybe they need a bit more practice to really nail a tricky topic. It's perfect for exam prep. It's basically an extension of school, doubling down on the syllabus. But it works on one big assumption, that the child already has the basic skills to take in all that extra information.
But this is where things get tricky, right? This is the question that makes so many parents pause. You've invested in the tuition, your child is doing worksheet after worksheet, but they're still falling behind. If just adding more content isn't working, what are we missing? It kind of suggests the problem might not be the what, but the how. And this table right here, it just nails the difference. It's a total shift in thinking. Tuition asks, okay, what topic is the problem? But learning intervention goes a level deeper. It asks, why is the child struggling to learn in the first place? See the difference? It's about treating the root cause, not just the symptom, like a bad grade in science. So that brings us to this idea of learning intervention. And if tuition is a content fix, you can think of this as a process fix. It's not about reteaching fractions. It's about building up the cognitive engine that lets a child learn fractions and history and English and everything else much more easily. So what are we actually talking about here? Well, here's the official definition. Learning intervention is structured, it's targeted, and its entire focus is on the process of learning. The whole idea is to give a child the tools they need to tackle the school curriculum on their own. So when we say the how of learning, what do we mean? We're talking about these core brain processes. Things like attention. Can they actually tune out the noise and focus? Working memory. Can they hold a few numbers in their head while doing a math problem? And executive functioning. Things like planning and organizing the steps to write an essay. These are the building blocks for all other learning. Okay, and right about now, a big question probably pops into your head. It's one we hear all the time. When we start talking about memory and processing and attention, it can start to sound an awful lot like therapy. And let's be honest, that can be a little scary for parents who are worried about labels.
All right, let's get super clear about this because it's so important. We have to draw a really sharp line between educational support, which is what learning intervention is, and clinical support, which is where therapy lives. They are not the same thing.
When we talk about therapy, we are talking about something that is clinical. It's a treatment provided by healthcare professionals, like a speech therapist or an occupational therapist, and it's there to address diagnosed developmental conditions. It operates in a healthcare world. Okay, this chart breaks it down perfectly. On one side, you have learning intervention. Its nature is educational. The focus is on academic skills. The goal is learning independence, and critically, it does not diagnose. On the other side, therapy. It's clinical, focused on treating conditions, aims for developmental outcomes, and very often it involves a formal diagnosis. So let me just say it one more time to be absolutely 100% clear. Learning intervention is not therapy. It is a form of structured educational support. It's for kids who are in school but are hitting a wall because of how their brain processes information. It's all about building skills, not treating a disorder. All right, so we have all this information. What do you actually do with it? As a parent, how do you take all this and choose the right path for your child and their specific needs? Let's think of it in 3 simple steps. First, just observe. Is the problem really just with one subject, like chemistry, or are you seeing a pattern across the board, forgetting instructions, getting distracted easily, feeling overwhelmed? Step 2, think about the cause. Does it seem like they just need more practice, or does it feel like there's a bottleneck in their learning process? Your answers there will lead you straight to the most effective support. So if you're reading this list and nodding your head, if any of this sounds painfully familiar, especially that one about falling behind, even with extra tuition, well, that's a really strong sign that the underlying learning processes are what need the support.
And if you do go down this road, what's the whole point? What's the goal? It all comes down to one single powerful thing: to build a confident, independent learner who has the tools they need to succeed, all on their own, long after the program is done.
I really want to leave you with this idea. Deciding to get this kind of help for your child is not admitting failure. It's an act of strength. It's you recognizing that learning is a complex thing, and giving your child the right tools is probably one of the most empowering things a parent can ever do.
So as you think about what to do next, just ask yourself this one simple question. Is the support you're looking at just treating the symptom, that bad grade on the test, or is it actually building the fundamental skill that will stop that symptom from showing up over and over again? Your answer to that question will tell you everything you need to know.
Thanks for watching. If you found this video helpful, please like, share, and subscribe. For further questions and inquiries, you may contact us at 65646533 or 8614-7651, or visit www.cognitive.com.sg.